Headaches always come at the worst time. They affect our quality of life, they interfere with our play, with our hobbies, with our work, with our sleep, and even our family time. In this video, I'm going to give you my top 5 supplements you should consider to help reduce the severity and the frequency of your headaches and migraines. I'm also going to tell you the exact dosage you should take. And at the very end of this video, I'm going to tell you 3 foods you have to avoid if you want relief from your headaches and migraines. Let's get to it. My name is Dr. Jon Saunders, and I've been helping patients for over 21 years deal with headaches, neck pain, dizziness, and a whole bunch of other spinal-related conditions. There are some things you need to take into account when you're considering supplementation. First, you want to make sure there's no medications that might interact with some of these supplements, and as well, if you have an underlying medical condition, you still want to speak to your doctor to make sure there's no contraindications. The first one we're talking about is ginger. I like ginger because it's easy accessible. Sometimes you might even have it in a powder form in your house. Ginger's great because it can act quickly. Studies show us that 500 milligrams of ginger at the onset of a headache or migraine can help decrease the pain within 2 hours. Ginger is a strong antioxidant and an anti-inflammatory, which is why it probably has this benefit. If you happen to have ginger in your house, you take a 1/4 teaspoon, mix it with water and juice, and just drink it down. If you don't have the ginger powder, then you can take it in a capsule form. The dosage should be around 500 milligrams per day. Ginger's been used for a long time and has been shown to be very effective and safe. Next, we have magnesium. Magnesium is a mineral that is involved in over 300 metabolic reactions in our body, including energy production, blood pressure regulation, nerve signal transmission, and muscle contraction, amongst many other things. I always suggest the best form of any of these minerals or vitamins or micronutrients is in food. The problem being is the dosage required to help alleviate headaches and migraines is not something that's easily attained through food. As well, when you start to talk about supplement form magnesium, there are many types and forms of magnesium. The 2 we're going to talk about today, as they are the most bioavailable, is magnesium citrate and magnesium bisglycinate. Both are readily absorbed from your small intestine. One thing I will say, magnesium citrate can sometimes act as a natural laxative. So those with sensitive stomachs, you may opt for the magnesium bisglycinate. The dosage you want to start with is between 400 and 800 milligrams daily. And the best way to take this would be with food to help minimize any gastrointestinal disturbances or upset. As well, you might want to consider breaking into 2 dosages over the course of the day. And just as a reminder, be consistent with how you take this over a course of weeks so you will notice the best benefit and the best reduction in headache frequency and severity. The next supplement we're going to talk about is Coenzyme Q10. Coenzyme Q10 is a very strong antioxidant. This helps act as an anti-inflammatory that will help alleviate some of the pain associated with your headaches and migraines. Our bodies do produce Coenzyme Q10, just not in the quantity we need them. Coenzyme Q10 is also found in foods such as meat, fish, seed oils, vegetables, and nuts, to name a few. The dosage required is between 100 and 150 milligrams per day, and it is best taken with meals for absorption as it is fat soluble. If you are considering Coenzyme Q10, and I think you should because it's really effective, have a conversation with your physician. Certain medications like blood thinners can interact with this. Like the others, be consistent on a daily basis so you will notice the effects of reduced headache intensity and frequency. And now on to one of the most important supplements, not only for reducing your intensity of headaches and migraines, but also for overall health. We have omega-3 fatty acids. I believe everyone should be taking omega-3 fatty acids in this day and age. It is so difficult to get the quantity we need on a daily basis to help our body feel good, function well, and heal well. Omega-3 fatty acids are found in fatty fish like mackerel, salmon. They're found in nuts, seeds, and flaxseed. The challenge is getting the quantity you need to help support a healthy body. Omega-3 fatty acids in the right ratio have an anti-inflammatory effect. They reduce inflammatory cytokines in the body, and this has been shown to reduce the severity and the frequency of headaches and migraines. The correct dosage of omega-3 fatty acids daily is between 2,000 and 5,000 milligrams of a combined EPA, DHA, and TPA. This is another supplement you want to have a conversation with your doctor about, as there can be contraindications with blood thinners and if you're on aspirin daily. There are so many benefits to omega-3 fatty acid supplementation beyond just headache reduction and severity. Things like cardiovascular health, brain health, they have mental health benefits, amongst many other conditions they can help with. It just makes sense to supplement with omega-3s daily to prevent any deficiency that might cause any chronic disease. Vitamin D. Vitamin D is a prohormone that regulates inflammation in the body. The best source is sunlight. If you can be out in the sun with your face exposed, your arms exposed, and your legs exposed for 15 to 20 minutes a day, that should be enough to provide you with a sufficient level of vitamin D. The problem being is it's very difficult to do, especially if you live in the Northern Hemisphere like I do in Canada. Vitamin D is something we absolutely need to have at sufficient levels for us to express health and resist chronic disease. Vitamin D levels are easily attained with some simple blood work. Typically, you want a blood level of vitamin D that's greater than 50 nanograms per milliliter. This is a test you should request from your physician to see if you have sufficient levels of vitamin D. The dosage of vitamin D for adults, if you are deficient, should be around 1,000 international units or IUs per day per 40 pounds or 18 kilograms of body weight. Vitamin D should be suspended in a healthy oil, not generally in a pill form, for it to be more bioavailable so your body can absorb it. One other thing we need to discuss is vitamin K2 when we talk about vitamin D3. When we talk about vitamin D3, we cannot forget about vitamin K2. Vitamin K2 and D3 work synergistically together to make sure calcium is being laid down in the proper places and to help with absorbability of calcium in the body. The recommended dosage of vitamin K2 is 100 to 200 micrograms per day, every day, especially when you're supplementing with vitamin D3. If you're on blood thinners or have other medical conditions, it's always smart to have this conversation with your doctor to make sure vitamin D3 and K2 is suitable for your case. As promised, I want to go through 3 foods you should reduce if you want to reduce the frequency and the severity of your headaches. The first being is alcohol. Alcohol acts as a diuretic, which can cause dehydration, which can be a trigger for certain headaches and migraines. Alcohol also causes vasodilations where the blood vessels expand. This can trigger changes in blood flow to the brain, causing headaches and migraines. Alcoholic beverages can also contain histamine and tyramine, compounds known to trigger headaches. So one of the easiest things you can do is start to reduce your alcohol intake. Dairy. Dairy can cause inflammation. If we can reduce our dairy, it's likely to reduce the intensity and frequency of your headaches and migraines. And finally, fried foods and processed meats. Reducing fried foods and processed meats will reduce the trans fats associated with inflammation in the body. As well, sometimes these types of foods contain additives and preservatives like MSG and nitrates, both known to be a trigger for headaches and migraines in some. And remember, if you want more specific and efficient help with your problem, it's always best to seek out local professional help. I hope you found this helpful. Give me a thumbs up if you did. Don't forget to hit the subscribe button if you're new to my channel so you can be informed when I upload a new video. Share this with someone you care about. At the very least, it will help reduce the intensity and the frequency of their headaches. Don't forget to watch these 2 videos. I can't wait to see you in my next video. Until then, stay well.